The first deaths have been reported in the cyclosporiasis outbreak, with both cases being from Michigan. The state's Department of Health and Human Services saying, quote, both individuals had significant underlying health conditions that may have been impacted by cyclosporiasis and dehydration. The two Michigan cases became ill prior to the voluntary recall of iceberg lettuce. And as officials work to identify the origin of the parasite outbreak, the state's total case count has now reached over 11,000, with 193 people in the hospital. Family and medicine physician Dr. Jessica Gray joins me now. Doctor, thanks for coming on to talk about this. You know, I've never seen so much lettuce on the shelves at a grocery store as what I did last week, and rightfully so. People are really, truly scared to eat lettuce right now. But for these two cases in particular of the people who died, what type of underlying ailments and conditions are we talking about here?
So there are definitely multiple different kinds of things that these patients could have had. But anybody who has maybe issues with their kidneys, issues with their heart, the respiratory system, something that would make them more prone or susceptible to having complications from dehydration. But even just elderly people or children and infants can be more prone just in general. But many conditions can cause us, even patients undergoing certain treatments like chemotherapy, who are just drawn down and their immune systems are lower. So it makes them harder to fight something like this off.
So how can they protect themselves? I mean, obviously, you know, water is not just going to cut it when you're so severely dehydrated.
So for somebody who is immunocompromised, they definitely want to seek out medical advice pretty quickly. If they're having anything that seems like a stomach bug that's lasting longer than 1 to 3 days, they need to go talk to their physician. If you're not immunocompromised and you're having something longer than 3 days that sounds like this with that diarrhea, that nausea, you should definitely talk to your doctor as well, because we have treatments. For this one specifically, unlike things like norovirus, which does not have a treatment, we have an antibiotic that works that's fairly common. It's trimethoprim sulfamethoxazole. Bactrim. It's a very common antibiotic that we can use that is effective.
Yeah, Bactrim, it's a very common one. The only issue I see with Bactrim, at least from people that I know, is that a lot of people are allergic to it. Is there an alternative to it?
Right. So if you have a sulfa allergy, that is the big problem right now. We don't have a really good alternative for this specific parasite treatment. We have a couple backup options, but they're just not as effective. So those who have a sulfa allergy, they need to be even more aware and informed of what's going on so they can seek out treatment, especially for potential dehydration more quickly.
Okay. And this is honestly the topic that has just stirred me up all day long. It says eating less protein could lead to a longer, healthier life. That's according to a new study. So the paper's lead researcher says, quote, it's absolutely crystal clear that there are benefits for protein for muscle growth and exercise responsive active individuals. But because most people are relatively sedentary, many people are likely consuming more protein than they actually need, which is probably having negative health consequences. You know, I think Todd wants to reach over and slap me right now because I have been on him about not eating enough protein. But I want to talk about this because is it the amount of protein people are consuming? Like, I mean, what is it? Is it hurting their kidneys? Why is it all of a sudden bad for some people?
So I think this is the problem when we talk about diet culture, especially the United States, is that we have a really everything is either one size fits all or it's all or nothing. And so right now you can see things like Doritos or things like that are adding protein in it, just trying to get on this bandwagon. So the idea of incorporating protein more often to build muscle mass is a great idea, especially in those who are actively exercising, building muscle. That's great. The normal amount that we recommend, though, is 0.8 grams per kilogram. And so you can calculate that out for yourself based on, you know, your weight converted to kilograms. And that's actually less than what people are talking about these days. So everyone who's been saying just push protein, we probably went a little bit too far in the other direction. Not necessarily that's truly harming people, but it's hard to stick with. And then people go back to maybe some of those bad habits before that weren't as positive proteins, or they're grabbing proteins like bacon, which is probably not the best source of protein.
No, you can't go anywhere without seeing high protein or a recipe online saying high protein this. It's like, okay, it's just a recipe. Dr. Jessica Gray, thank you so much for your time. We appreciate it.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox 1.